people studying what were the things that happened in those few 10,000 years that transitioned the gray wolf population into the now 350 to 400 breeds of dogs that we see worldwide. And we've been privileged to be part of some of those discussions, but I'm actually going to set those aside and not talk about that at all today. Instead, what I want to talk about is the amazing variation that we see as we look at different breeds of dogs. Now, there are about 70 breeds that are recognized in the United States by the American Kennel Club, the AKC, which is the largest registered body of dogs in the United States. And it's really quite striking. In order to be a member of the Golden Retriever breed, your parents have to be Golden Retrievers, your great-grandparents have to be Golden Retrievers, and so on and so on. So when we think about, well, why do we study this genetics? What is it that we're so interested in doing? We're interested in looking at that heritable variation. What makes a Golden Retriever and his parents and his offspring all look the same compared to a Weimaraner, compared to a giant Schnauzer, and so on and so on. So we study the genetics of variation
in all of those areas. So not so different really, but quite complex as we're trying to make many moving parts all move toward health goals.
Thank you. I think we have time for 2 more questions.
Good morning. Thank you very much. And I take advantage of this very nice faculty to inform you of some research which we are doing in Italy. I am a senior oncology surgeon, and I have opened a new investigation area about comparative pets and human oncology. But the question that I want to address to this faculty is that we are studying intensively also some other disease that needs chronic inflammation, which are similar in human and pets. And in this case, there is some recent studies of an old 25 professional old vet, which is named Sergio Canello, which we endorsed in our university because he tried to demonstrate that in the pet food there are some deoxycycline metabolites and tetracycline residues that come from the pet food through the proteinated bones of animals. And these deoxycycline residues are able to trigger cytokines that give general inflammation to skin, also to the brain, with mood behavior modification, and also to the absorption of food. And the other question which I want to ask you is if you have taken into account in the vet medicine also the possibility that microbiome is able to modify the obesity and the state of the weight of the dogs, as well we see in the humans. This is a new trend. That means inflammation and microbiota are both involved in disorders of eating and obesity. Thank you.
There's a lot of research currently going on microbiome in a lot of aspects of veterinary medicine, including obesity, as well as anti-inflammatory approaches, and many diets now do contain antioxidants, omega-3 fatty acids, and other compounds that may have some anti-inflammatory effects. So there's a lot of interest in diet being able to help manage or prevent chronic diseases.
And from a behavioral perspective, actually, this is where I often do reach out to my veterinary nutritionist colleagues, but we do have concerns about additives, et cetera, in the commercially prepared dog foods. Overall, of course, we're looking for mainly a diet that is a healthy ration that's balanced for our patients. The reason that people buy commercially prepared dog foods is because it's tradition and because it is much more convenient. But when possible, and although there's very little scholarly research, at least I've been able to identify, you could probably speak to this in a lot more detail, on behavior and nutrition, there is some. And anecdotally, just like there's a lot of anecdotal work in anxiety, especially in children and autism, et cetera, with nutrition, if we can get these patients on a well-balanced but home-cooked ration, we will do so that we can decrease the chance of additives of all types. And so that we have more of a known source idea behind where our nutrients are coming from for those patients. In my clinical experience, the change in behavior related to a diet change alone is rare, very, very rare, but it does happen. And in my practice, we are also using probiotics sort of every once in a while with patients that have comorbid diseases like inflammatory bowel disease and dermatopathies. The idea of trying to help balance the microbiome, but that is just basically me running wild with it. So I'm the only clinician in my practice, so nobody told me how to do it.
Well, we unfortunately going to have to cut